everyone who took the time out. Thank you so much, Natalie. Thank you so much to everyone who took time out of their busy day to join us today. I hope that this today's lecture will be fruitful for those of you who have or are in the process of considering value-based care initiatives such as chronic care management and remote patient monitoring. I'd also like to thank the national MGMA, as well as each representative state chapter for promoting this on LinkedIn and other such social media platform. And just to remind everyone that this meeting is recorded, and after the webinar, you can claim your CME credit. We will take Q&A, and so whatever questions you may have, feel free to write them down. I'd hate for you to lose them. And with that being said, there will be a post survey sent by me to everyone in attendance to just to see how best we can serve you or clarify things or even help you. And with that being said, let's begin. Today's learning objectives include the following four. Understanding the key components and reimbursement structures of Medicare's chronic care management program, learning how to identify eligible patients, as well as implementing a compliant as well as effective CCM workflow, discovering how CCM or chronic care management can improve clinical outcomes as well as patient satisfaction while reducing avoidable hospitalizations, and lastly, exploring best practices for integrating CCM into primary care practices, federally qualified health center, and rural health clinics, as well as specialty clinics. A little bit about myself. As Natalie so aptly said, my name is Dr. Cedric Bajitu. I am a clinical pharmacist for the last decade, as well as the founder of Chronic Care. So as we begin and dive into chronic care management and value, I feel it's important to talk a little bit about value-based care. And so if you're paying attention to Medicare and some of the talks taking place in Washington, a common term that's being thrown around is value-based care, which is somewhat different than what many of us in our profession are used to hearing, which is fee-for-service. But just to differentiate the two, value-based care is based off of a healthcare model that prioritizes quality and outcomes over the volume of services provided. And so the aim of this pivot or transition towards value-based care is to improve patient health while at the same time reducing the ballooning healthcare costs this country faces. Just to further clarify the differences between value-based care and fee-for-service, I wanted us to take a look at a comparison. One focuses on a provider incentive shift, which is in value-based care, providers are actually rewarded for delivering high-quality care as well as achieving better patient outcomes. And so this approach is meant to encourage a focus on improving health, which ultimately can lead to reducing hospital readmissions. There's also a greater emphasis on care coordination with regards to value-based care, because value-based care promotes strong communication as well as teamwork among healthcare providers in order to ensure smooth patient transition. I think in our current model, which is fee-for-service, we find that there's a lot of cracks in the transition of care that a lot of patients experience. And so many patients unfortunately fall through those cracks. And so this coordination is actually meant to help reduce errors and enhance overall patient management. Now, what's interesting about value-based care is its impact on healthcare delivery, cost, as well as patient outcomes. Value-based care will tend to emphasize preventative measures such as regular screenings, vaccinations, in order to empower these patients to manage their health, even so much as being proactive about their health. And so this proactive approach will reduce the likelihood of severe health crises, which will ultimately lead to improved overall patient health and well-being. There is a great emphasis on chronic condition management. And the initiative is aptly called chronic care management. And what it is, it's meant to provide comprehensive support for patients or individuals with chronic conditions, enhancing self-management skills as well as improving patient outcomes. It includes a personalized care plan as well as regular monthly monitoring, which can help patients effectively manage their symptoms outside of the doctor's office. When it comes to hospital readmissions, studies have shown that a well-established CCM program can significantly reduce emergency department visits as well as hospital readmissions by proactively monitoring patients. Early detection of potential health issues allows for timely interventions, ultimately lowering the overall cost of healthcare. I want to get into take a deeper dive into chronic care management itself. Chronic care management is a service designed to provide comprehensive support for individuals with two or more chronic conditions. Now, I do want to clarify the term chronic care management is often thrown around, but it often includes an umbrella term. It is often an umbrella term which includes things such as principal care management, remote patient monitoring, as well as transitional care management. So you'll often hear the term chronic care management, but it is often misused if, in a way because principal care management is essentially the same thing as chronic care management, except it applies to patients with only one chronic condition. And so the primary purpose of all of these terms, be it chronic care management, principal care management, remote patient monitoring, or transitional care management, their purpose is to improve overall patient outcomes and enhance self-management skills through coordinated care. It offers consistent support and monitoring in between physician visits, ensuring that patients receive ongoing guidance in managing their health. This is usually provided on a monthly basis and includes regular check-ins, medication management, and self-care education. Effective care coordination is central to a chronic care management program. And so this involves collaboration among healthcare providers in order to streamline communication and enhance patient care. This approach helps to ensure that hospitalizations are reduced and overall health outcomes are improved. There is evidence supporting the use of chronic care management. Just to give you a background, chronic care management was initially implemented back in 2015. So it has been around for about 10 years. Unfortunately, it has not gained the traction that Medicare had hoped that it would gain. I believe when last surveyed in 2019, only about 4% of Medicare enrollees were receiving any form of chronic care management. That number has slightly gone up, but it is still far below the goal of offering these types of services to every Medicare enrollee so that all of them can share in the many benefits accrued with this type of program. Studies have shown that CCM significantly reduces emergency department visits and hospital readmissions by proactively monitoring patients and identifying complications early on. Patients receiving CCM services experienced a 20% reduction in hospital admissions compared to those who did not receive any form of chronic care management. It can also enhance patient engagement metrics. Chronic care management enhances patient satisfaction as well as adherence through proactive communication and personalized care plans, fostering a strong therapeutic relationship between the patient and their providers. Regular check-ins as well as support lead to improved adherence to treatment plans and medications and involve increased patient involvement in their health management. And case studies include a rural health clinic which successfully implemented a CCM program, found that it reduced hospital readmissions by up to 30% within just 1 year. And this showed the effective management of chronic condition with a CCM program. Another such case study found that a community health center serving underserved population found a 25% increase in patient satisfaction score as well as an 18% decrease in emergency room visits through targeted CCM initiatives. So there is evidence backing the implementation of these programs, both in hospital settings, in federally qualified health centers, rural health clinics, and primary care offices. Let's talk about eligibility. In order for a Medicare patient to qualify for CCM, they must have two or more chronic conditions, and these conditions are expected to last at least 12 months. Now, just to clarify, and I do want to reemphasize this, chronic care management specifically applies to patients with multiple chronic conditions, two or more, that is, whereas principal care management applies to patients with one chronic condition, essentially the exact same program, but it applies to those with one chronic condition. Now, these conditions must significantly impact their health status and pose risk of death or functional decline over time. And so the care requirements include developing and revisioning of a comprehensive care plan, which is an essential part of the program. Patients must have access to care management services 24/7. That means patients must be able to reach out to their care coordinators at any time during the day, and they must receive monthly follow-up phone calls. Now, there are billing codes that are a crucial part of these types of programs, and such codes include billing code CPT 99490, which includes 20 minutes of clinical staff time directed by a physician or qualified healthcare professional. There's also CPT code 99439, which includes an additional 20 minutes of clinical staff time in conjunction with 99490 for up to 40 minutes and 60 minutes of patient encounter. Other codes include CPT code 99457, which represents 20 minutes of clinical staff time spent on remote patient monitoring. And then that also has an additional 20 minutes of remote patient monitoring in conjunction with CPT code 99457, and that is CPT code 99458. And of course, CPT code 99424 applies to 30 minutes of clinical staff time, this time directed by a qualified health professional. And we'll look into those billing codes in future slides. There is a provider incentive to implement these programs within your practices. Medicare provides financial incentives for practices offering chronic care management services. Now, reimbursement rates vary based on the complexity of patient care, as well as the time spent providing these services. And might I add, the number of patients, of Medicare patients, that are enrolled within a particular practice. Now, in addition to the provider incentives, there are financial benefits to implementing these types of programs. Chronic care management can lead to reduced hospitalization and healthcare costs. And this can mean improving scores such as MIPS and MACRA, and the effective management of chronic conditions through chronic care management can improve overall practice revenue as well as sustainability. So this is the process by which we can identify and enroll eligible patients in our CCM program. The first step is to identify those patients within your EHR that are Medicare eligible, so 65 and older, as well as those who have any form of chronic condition. And so we can do this by utilizing the EHR system as well as data analytics to identify those patients by simply generating a report, identifying those patients who are eligible and who we believe may benefit from these types of programs, with a greater emphasis focused on those with frequent hospitalizations or poor medication adherence. The next phase is to communicate the benefits of these types of programs to patient in order to obtain patient consent or patient buy-in. And so the next phase is to communicate the advantages of CCM to those eligible patients, emphasizing improved care coordination and personalized support. This education is crucial for gaining patient buy-in and ensuring informed consent. The third step is to streamline enrollment process. This can be in the form of integrating a simplified enrollment process into existing workflows in order to minimize administrative burdens. Providing assistance to patients during enrollment to facilitate their participation in CCM. This can be done by way of phone calls. This can be done by way of reaching out to them by email or text messages. And the fourth step is to utilize EHR and data analytics in order to track patient data and monitor the patient progress each and every month. This ensures that care plans are tailored to individual needs and can be adjusted as conditions evolve. When it comes to developing and maintaining a patient-centered care plans, this is absolutely crucial. The first step your team may want to do is gather detailed patient information, including medical history, medications, lifestyle factors, as well as social determinants of health. This thorough assessment is meant to form the foundation for developing an individualized care plan. The next step is to set realistic goals. We collaborate with patients in order to establish SMART goals. These are specific, measurable, achievable, relevant, and time-bound. Setting realistic goals with patients early on enhance patient engagement as well as motivation. It's important they feel that they are part of their care plan. Personalized interventions are crucial because a good care plan should be tailored to each patient's specific needs, focusing on medication management, lifestyle changes, as well as access to community resources. Personalized interventions can ensure that patients receive the most appropriate and effective care. Making sure care plans are regularly updated is important because continuously monitoring patient progress and revising care plans as conditions evolve allows us to stay on top of patients. Regular updates ensure that the care plan remains relevant and effective in meeting the patient's ever-changing needs. And of course, engaging patient is crucial because involving patients as active participants in their care by encouraging them to ask questions and providing feedback along the process goes a long way. Engaging patients fosters a stronger relationship with their care team and improves adherence to treatment plans. When it comes to effective coordination and communication within care teams, this is crucial. It is absolutely important that within your virtual care team, roles are defined. Clearly outline responsibilities for each team member in order to avoid duplication and confusion. It's very important that the pharmacist knows what their role are, the nurses know what's expected of them, as well as the care coordinator, that each one knows what is expected of them so that no one is stepping over the other one's toes or responsibilities. Ensure that each member of the care team understands how their role contributes to the overall success of the care coordination effort. Excuse me. Making sure you have secure communication is crucial. It's important to use HIPAA compliant tools. Excuse me. It's important to use HIPAA compliant tools to secure. Uh, it's important to use HIPAA compliant tools for secure and efficient information sharing among care team members. This can facilitate real-time communication to ensure timely responses to patient needs and update. We are dealing with patient health information after all. This is another overview of the billing codes used for chronic care management and remote patient monitoring. With remote patient monitoring, the first month there's a billing code, a CPT code 99453, which represents the initial patient setup and enrollment into RPM program. It averages $20. Mm. Following that, CPT code 99454 represents monitoring and management of 16 days of device data. This simply means that within 30-day period, should that patient utilize the health device or the medical device 16 out of those 30 days, the very least, Medicare reimburses an average of $43. Now, code 99457 represents 20 minutes of clinical staff time spent with a patient or caregiver, and it averages $48. Code 99458 represents an additional 20 minutes of clinical staff time spent with a patient or caregiver. The average reimbursement is $38, and it can be billed again for another 20 minutes of clinical staff time with a patient or caregiver, of which the average reimbursement is $38. Now, when it comes to chronic care management, CPT code 99490 represents 20 minutes of staff time spent with patient or caregiver. It averages $60.49. And there's an additional 20 minutes of clinical staff time that can be billed under CPT code 99439. And that can be billed a second time for an additional 20 minutes of clinical staff time spent with a patient up to 60 minutes. Where a patient has multiple chronic conditions which are complex in nature and require an extended period of time in order to fully address them, CPT codes 99487 simply apply. And this represents 60 minutes of clinical staff time spent with a patient or caregiver. And the average reimbursement is $131.65. And if that goes beyond the 1 hour, the 60 minutes, CPT code 99489 would be generated. And that represents 30 minutes of clinical staff time with a patient, with that same patient or caregiver. And the average reimbursement is $70.52. Now, to clarify, these reimbursement rates apply to New York State. Each state's reimbursement rate is slightly different. They're not too far off, but these prices, these reimbursement rates that you're seeing mainly apply to New York State. There are some common documentation and compliance challenges with starting a chronic care management program. It is important to make sure your system has accurate time tracking. This is important because ensuring precise documentation of the time spent on CCM and RPM services is actually essential for proper reimbursement. Inaccurate time tracking can lead to underpayment or even worse, penalties. It's important to make sure you're creating detailed comprehensive care plans. Developing these detailed care plans that meet Medicare guidelines is crucial for compliance. An incomplete care plan may result in audit denials and hinder effective patient management. It is crucial to obtain patient consent before starting these programs. Obtaining and documenting explicit patient consent for CCM and RPM services is vital for ethical practice. Patients must understand the nature of the services and their rights regarding data privacy. This is also important because patients have the right to opt out of these programs at any time that they so choose. And it is important to make sure we avoid service duplication. Preventing billing overlaps between CCM and RPM and other care management services is essential for accurate billing. Duplication of services can lead to overpayment and potential penalties for Medicare. There are strategies to optimize reimbursement and ensure regulatory adherence. The first strategy is making sure your staff is well and properly educated. Regularly train billing and care management teams on updated Medicare billing requirements and documentation standards. Ongoing education can be delivered through workshops, online training modules, and regular staff meetings. It's important that your staff understands the EHR software that you're using. Leveraging EHR systems with built-in features to track time, manage care plans, and generate reports for compliance and purposes. Utilizing these EHRs can improve accuracy, reduce errors, and simplify the billing process. Workflow optimization. It's important to create standardized processes for enrolling patients, documenting interactions, and billing to ensure consistency and accuracy. The streamlined workflows can help reduce errors and improve staff productivity. Keeping track of your key performance indicator. Regularly track key performance indicators or KPIs such as denied claims and patient engagement rates to identify areas in need of improvement. It's important to analyze these metrics because they can inform you of adjustments that need to be made to your workflow and how to steer your training programs. And be mindful of regular audits. It's important to conduct your own internal audits of billing practices and documentation in order to identify and address errors before external reviews from Medicaid. Proactive audits can help minimize the risk for penalties and ensure compliance with Medicare regulations. Mhm. Let's talk a little bit more about how remote patient monitoring can enhance chronic care management. Remote patient monitoring devices provide real-time health insight, allowing healthcare providers to track vital signs continuously. This ongoing monitoring enables proactive interventions in order to manage chronic conditions more effectively. When it comes to patient engagement, remote patient monitoring fosters a stronger connection between patients and their care teams through regular updates and feedback. Every time they use these medical devices, data is updated through the EHR, so the providers or the care team has insight into what is going on at the patient's home. Engaged patients are more likely to adhere to treatment plans and take an active role in their health management. It allows for early issue detection. By continuously monitoring patient data, remote patient monitoring helps identify potential health issues before they escalate. Early detection can significantly reduce the need for emergency visits and hospitalizations. And of course, with regards to CCM integration, integrating remote patient monitoring with chronic care management creates a comprehensive approach to patient care, enhancing care coordination efforts. This synergy leads to improved patient outcomes and more efficient management of chronic conditions. It's important to use EHR software and data analytics in order to track patient progress throughout the process. EHR provide a uniform platform for care teams to view comprehensive patient information, including medical histories, medications, and lab results. This centralized access ensures that all care team members are aligned and informed about the patient's current health status. This can also be used to help track performance of your staff. Data analytic tools track trends in patient health metrics over time, identifying areas where interventions are needed. For example, monitoring blood sugar levels in diabetic patients can highlight adherence challenges and inform care adjustments. It also helps with risk stratification. Predictive analytics within certain EHRs can identify high-risk patients for analyzing factors by analyzing factors such as their age, their medical history. This allows healthcare providers to prioritize resources and allocate care effectively to those who need it most. EHRs can also help with care plan optimization by enabling dynamic care planning by allowing real-time updates based on patient progress and evolving health conditions. Regularly updated care plans ensure that ensure that interventions remain relevant and effective in meeting patient needs. And EHRs can help with population health management. Aggregated patient data from EHRs provide insight into health trends and the effectiveness of care strategies across populations. This data-driven approach supports initiatives aimed at improving overall health outcomes and reducing health disparities. Examples of tools and platforms that can support care coordinations. We've highlighted a little bit about EHR systems. So these include platforms like Epic, Cerner, Athena Health, and even HealthArc. They provide integrated tools for managing care plans, tracking patient progress. These systems facilitate communication among care team members and ensure access to up-to-date patient information. There are also RPM or remote patient monitoring devices. These include wearable devices such as Fitbit and Apple Watch, which can offer continuous health data for real-time monitoring. Specialized health monitors such as Omron and Dexcom can provide actionable insight into patient health metrics. There are care coordination tools such as Care Harmony and CCM Navigator, which can help enhance communication and automate documentation processes. These tools streamline workflows and ensure compliance with regulatory requirements. And there are also telehealth platforms. Solutions like Teladoc Health and Amwell enable virtual consultations, improving access to care for patients in remote areas. These platforms facilitate regular check-ins and ongoing support, enhancing patient engagement. There are real-world examples, which we mentioned earlier, of successful CCM implementation, such as the rural clinic, which implemented a CCM program targeting patients with heart failure and diabetes. They managed to achieve a 30% reduction in hospital readmissions within just 1 year of the program going live. These advantages and benefits can also apply to other modalities or other practice settings within healthcare, such as a multi-specialty practice, which integrated remote patient monitoring for their hypertension patient. They found that within just 6 months, they had improved blood pressure control rates, which went from 60% to 85% in just 6 months. And also, a successful CCM program can also benefit community health centers. A community health center partnered with a CCM vendor to serve their underserved populations living with chronic conditions. What they found was an increased patient satisfaction score by 25%, and they managed to successfully decrease emergency room visits by 18% within just 1 year of starting the program. There are best practices for integrating CCM into your existing workflows. First is a needs assessment. It's important to identify gaps in your current workflows and evaluate patient needs in order to determine how CCM can address them. This foundational step ensures that the integration of CCM is tailored to specific practice requirements. There's also stakeholder engagement. Within a practice, it is important to involve physicians, care coordinators, as well as administrative staff early in the planning process. Gaining buy-in from all stakeholders is critical for successful CCM implementation. Then there's process standardization. It's important to create clear protocols for patient identification, enrollment, care plan development, as well as documentation. A standardized process enhances efficiency and minimizes confusion during implementation. There's the use of technology, leveraging EHRs, RPM devices, and care coordination platforms in order to streamline workflow. Utilizing technology improves efficiency and facilitates better communication among care team members. Hmm. And then there's team training. It's important to regularly train your staff on CCM guidelines, billing codes, and patient engagement techniques. Ongoing education ensures that all team members are equipped to deliver high quality CCM services. There are common challenges and barriers in implementing a CCM program. There's commonly patient enrollment resistance. It's important to it's important to emphasize the need to educate patients prior to starting a CCM program. The importance of educating them is lies in the fact that this Medicare population, older patients, they tend to be wary of scams. They tend to be wary of any new gimmick or program that anybody who calls them, whom they are not familiar with. And so, before rolling out a program, it's important to educate and reach out to your Medicare enrollees, Medicare patient population, letting them know of the program that's being shaped and and getting their buy-in by selling them the benefits to their health. And you can also share success stories to build trust and encourage their participation. We find that hearing directly from the provider, from the physician, from the doctor, from the nurse practitioner, words of encouragement goes a long way in order to convince these Medicare patients to give consent to participate in these types of programs. And it's important to be mindful of staff workload management. You want to streamline workflows to reduce administrative tasks for staff. Use technology in order to automate routine processes and improve efficiency. And of course, documentation compliance is crucial. Train your staff on Medicare documentation requirements. If needed, implement EHR systems with compliance features already built in order to simplify record keeping. Reducing provider burnout through streamlined processes is crucial. Task automation is the process of integrating technology, such as EHRs and care coordination platforms. Automation of of routine administrative tasks will go a long way into reducing provider burnout because this reduces the time providers spend on documentation and billing, allowing them to focus more on patient care. Team delegation is also important to setting up a successful CCM program. It's important to assign non-clinical tasks to care coordinators because this helps alleviate the workload on providers. This delegation allows providers to concentrate on clinical decision-making and patient interactions. And of course, implementing proactive care models emphasizes preventative measures, reducing the frequency of crises. This approach minimizes the stress and time demands placed on providers during acute situations. And of course, there's financial support. Optimized billing and improved reimbursements from CCM services contribute to practice sustainability. Financial incentives help reduce the financial stress on providers, enhancing their overall job satisfaction. We also want to be mindful of social determinants of health that these patients are living with. Holistic care planning deals with integrating clinical and non-clinical aspects of health to ensure comprehensive support for patients. Now, not every patient is the same. Not every patient has access to the same resources. So when dealing with your patient population, it's important to identify those who lack and may be in greater needs of community resources. In fact, those patients are perhaps the ones who most benefit from a CCM program. This approach addresses individual needs, leading to improved health outcomes and satisfaction. Community resource connection. Connecting patients with local resources, such as food banks and housing assistance, can help address social determinants of health. These connections enhance patients' overall well being and satisfaction with care. Health equity. Targeting underserved population ensures equitable access to care and builds trust. This focus on health equity improves patient satisfaction by addressing disparities in healthcare access. We want empowered patients. Engaging patients in their care plan on a monthly basis fosters a sense of ownership and accountability. When patients feel heard and supported, their satisfaction and health outcomes improve, quite often significantly. And of course, we want a data-driven approach because utilizing metrics related to social determinants of health allows for the identification of trends and targeted interventions. This data-driven strategy enhances care coordination and patient satisfaction. Personalized care can help build stronger relationship between patients and their care team. Within these individualized care plan, each patient receives a care plan that is tailored specific to their specific needs and conditions, even preferences and goals, enhancing their sense of value and engagement. Personalized interventions ensure that patients receive the most appropriate and effective care possible. Frequent communication is also important between patients and their care team. Regular follow-ups, check-ins, and remote monitoring keeps patients connected to their care teams, building trust and accountability over time. Effective communication fosters a strong therapeutic relationship, ensuring that patients feel heard and supported. This contributes to emotional support. Care teams address both clinical and emotional aspects of care, ensuring that patients feel supported throughout their health journey. Providing emotional support enhances patient satisfaction and encourages adherence to treatment plans. Now, there are trends in Medicare reimbursements to physician. Let's take a look at the impacts on chronic care. Strategic planning, which is the formation of care management steering committees. A lot of practices are realizing that they do not have the staff, the manpower, nor the time to start their own CCM programs. And so what is more increasing, what have become increasingly common are those practices who look to outsource their CCM efforts by partnering with companies that will provide this service on their behalf as an extension of their practice. They're able to keep their staff focused on patient care or clinical care while an external party provides these CCM and RPM services. And so these are commonly found in clinics with a high chronic disease burden. It's important to centralize operations. A central hub for CCM and RPM with nurses and pharmacists contributes to overall patient care. A shared EHR and remote monitoring dashboard facilitates communication between each person or each member of the virtual care team. Of course, patient enrollment is crucial. You won't get very far without being able to convince patient to partake in these programs. So it's important to use your EHR platform to identify those eligible patients, often through clinician referral. And for those patients who need additional support and remote monitoring, it's important to provide them with RPM devices during enrollment. That way, we can provide an additional layer of monitoring to these patients on top of the monthly phone calls. Now, reimbursement is important within any workflow. Utilize CCM-specific EHR templates for documentation. And this can help with when it comes to submitting appropriate billing codes for reimbursements. And of course, there's quality monitoring. The hospital found that implementing the CCM program as well as a transitional care monitoring program, management program, reduced readmissions, decreased by 22% in just 1 year. An active CCM patient, a CCM population of about 1,000 enrolled in a patient in a CCM program can generate up to $1.8 million in gross revenue. Now, there are key takeaways when it comes to Medicare and the pivot towards value-based care from fee-for-service. Unfortunately, the trends for Medicare over the last 20 years has seen overall decrease in reimbursement rates for fee-for-service. When it comes to non-face-to-face growth, there has been, especially due to the COVID-19 pandemic, but we have seen an increased use of remote care codes, especially with the adoption of telehealth services. And of course, CCM has expanded the settings where in which it can be applied. So now you can apply CCM in various healthcare settings. This can include primary care practices. This can include internal medicine practices, federally qualified health centers, any sort of specialty practice, including gastroenterologist, cardiologist, essentially any healthcare setting that treats and takes care of Medicare patients can effectively begin their own chronic care management program or outsource it to to an external company to provide these services on their behalf. Hmm. There has been significant growth in non-face-to-face reimbursements. For example, when it comes to the payment shift, we can see that emphasis has shifted towards primary care and chronic condition management. We find over the last 10 years, since the start of CCM, new codes for chronic pain management and social determinants of health have been introduced. It just to give you an idea, in 2015, CCM was introduced. By 2020, ECM was introduced, and then later on, transitional care management, and then RPM, remote patient monitoring. So every couple of years, we're expanding the scope of these value-based care initiatives. Now, the revenue potential for a practice that successfully implements a CCM program is significant. Just CCM alone can generate anywhere from 150 to $200 a month per patient through these types of services. And so when we look down the stream, when we look into the future, we can expect to see continued cuts to base fees with a growth in value-based care incentives. Just to give you an idea, when chronic care management was first introduced back in 2015, the first 20 minutes was reimbursed 40 at $42 for the first 20 minutes. Today, it's about $61, depending on the state you find yourself in. So it's grown significantly, and we can expect it to continue to grow because we understand it as Medicare incentivizing providers to implement these programs within their practices. When it comes to 2025 and beyond, with regards to reimbursements for fee-for-service, we can expect continued cuts to base fees. When it comes to non-face-to-face growth, or in other words, virtual care, the virtual care model, which is found in value-based care, we see remote care codes are increasingly utilized, especially as more and more healthcare settings are introducing these programs with it to their patient population. And within healthcare setting, primary care facilities are effectively implementing CCM and RPM. And for those who don't have this time, nor the staff or manpower to effectively implement these programs, outsourcing is another thing they can do. We're seeing more and more physicians partnering with external businesses in order to outsource their CCM and RPM responsibilities. And so, just to share with you some of the healthcare settings that benefit from CCM and RPM implementation, we are talking about primary care practices. Ideally, those practices that manage large panels of Medicare patients. And so these practices stand to gain and benefit significantly, as well as their patients, because they can enhance patient engagement as well as reduce overall hospitalizations. We're finding accountable care organizations that are considering implementing CCM as well as RPM programs because these support shared saving goals by reducing emergency department visits and can improve quality benchmarks and HEDIS measures. Federally qualified health centers as well as rural health clinics are increasingly implementing these programs because they're actually eligible for general care management codes that are unique to their own settings. And so for these types of healthcare settings, they stand to gain because these programs can bridge care gaps within their underserved population. We're seeing home health agencies implementing these types of programs in order to help extend the value of episodic visits with RPM, which can help them monitor patients in between visits for better care. And of course, we're seeing specialty practices begin to implement these types of services in order to maintain oversight of their high-risk patients and enable real-time interventions on biometric changes. So again, these specialty practices can include cardiology offices, your gastroenterology offices, endocrinologists, you name it, anyone who sees Medicare patients and helps manage or treat their chronic conditions, they can bring these types of program within their settings. To conclude, with regards to value-based care impact, we find that value-based care shifts the focus from volume of patients seen to the value provided to these patients, enhancing patient outcomes and satisfaction while reducing cost through preventative measures. With regards to chronic care management, it emphasizes the coordination of care for patients with chronic conditions. It fosters enhanced patient engagement as well as self-management. And so successful components for a CCM program include comprehensive care plans, regular patient monitoring, and interdisciplinary care teams that collaborate effectively. And so strategies for implementation, effective implementation strategies involve training your healthcare providers on CCM practices, utilizing technology for patient tracking, and engaging patients through education and support. And overcoming some of the more common challenges faced by practice directors and practice owners include addressing challenges such as provider burnout, Ensuring patient compliance and understanding and navigating reimbursement complexities is essential for the successful implementation of chronic care management programs. I want to once again thank everyone in attendance. I want to thank you for your time. My name is Dr. Cedric Batchetu. I thank the National MGMA as well as each state chapter of the MGMA for promoting this program. I want to thank Natalie and team for setting this whole thing up, and I want us to transition to Q&A. Thank you.
Wonderful. Thank you. This was fantastic. I did want to ask anyone in the audience if they do have any questions, please submit them through the Q&A right now. I did have one for you though already. And just in your opinion, what metrics beyond the standard CMS requirements do you find would be most valuable evaluating the success of a CCM program?
That is a great question. There are many metrics that are actually important. It depends on the software that you use or the the EHR software. Can I speak from my experiences? I just want to be clear.
Absolutely.
Okay, so from my experience, the software that we use allows us to track um, not only our staff, but it allows us to track patient engagement. So we are able to see the level of engagement. We're able to see how much time is spent for our care team speaking with patients. We're able to communicate with them through text messages if they are so tech savvy. And one of the things that's unique about our program that when compared to other CCM providers out there, and just clarifying, I am talking about my personal company and our approach. I just want to make that uh, distinction. One of the things that makes our approach unique is that we offer a self-care management program, which emphasizes the dietary and lifestyle changes gradually over time. And so we're able to track not only patient engagement when it comes to getting in touch with their care managers, but we're actually able to track the level of engagement with our dietary and lifestyle program. Another thing that we do is we have pharmacists as part of our care team. Now, Medicare does not require pharmacists to be part of the care team. We included pharmacists as part of the care team because 50% of the reasons why these seniors end up going to the hospital in the first place are due to medication adverse events or medication non-adherence. As a pharmacist, I felt that it only made sense. It was only logical to include a pharmacist within that care team. And so we're able to let all of our patients know that should you have any questions regarding your medications, can call your care coordinator and relay those questions or concerns, at which point within 24 hours, that pharmacist who is assigned to you will get back to you. It can be as simple as maybe they watched the news and in between on a commercial break they saw a supplement that promised to get rid of their arthritis or something or their joint pain. And so, they a lot of seniors, they just buy these things and a lot of times they don't work. But we give them the ability to then call us and have the pharmacist within their care team look into or research the particular drug or supplement that they've seen, or just any question or concern that they have. And so our metrics are a little different than what other providers of these services utilize, but our metrics are I'd like to say a little bit more thorough because we want to know how they're adopting and interacting with our self-care management program, with our pharmacist, and so we track those things.
Wonderful. Thank you. I think that's really helpful to know just for context overall. I didn't see anything come in over the chat, so I think that we are all set and we can wrap it up. Just for everyone here in the audience, keep an eye out for an email probably later this afternoon with a quick survey. And I just wanted to say one last thank you. This was fantastic, and we really, really appreciated having you.
Thank you so much. I look forward to hearing working with you again. We've got other topics that we're happy to share, and I thank everyone
Wonderful.
for giving me your attention this hour.
Wonderful. Well, have a great rest of your day. Thank you all.
Thank you, Natalie. Thank you, everyone.